The Ashanti Regional Health Directorate says adolescent pregnancies have declined over the past 5 years, despite the region leading in national figures. According to the Health Management Information System, the region recorded 89,856 between 2016 and 2020. But Deputy Regional Director in charge of Public Health, Dr. Roxanne Michael J, tells JoyNews there has been a decline in trend from 11.4 in 2016 to 10.9% in 2020.
We are not happy with where we are. We still believe a lot can be done. From 2016 right down to 2020, we can see the trend. There is the absolute number of pregnancies that occurred within this group, 10 to 19 years, over the past 5 years by a year. There is what was aggregated by a certain media house to give a very huge number of pregnancies within our region. But breaking it down to years, you could see that, yes, we are hovering around 18,000 on the average every year. This number of girls get pregnant. Like every indicator within them, you have to look at the population as well, because every year our population keeps on increasing. And the Ashanti region is also one of the most populous within our country. So you're likely to find a lot more girls getting pregnant compared to other regions that have a lower population. So that's why the fact that the absolute figures stay around 18,000. The populations have been changing. But by the rate, what proportion of pregnancies in the region is due to adolescents, 10 to 19 years. 2016 was 11.4, came down 11.2, stayed so in 2018, shot up a little in 2019, and 2020 came down to 10.9.
My colleague Ohim of our Health Desk is at the stakeholder consultative meeting being organized by the Regional Health Directorate. He joins me via Zoom with more. Ohim, even though there's a declining trend over the period, is the Health Directorate not concerned with the number of teenagers getting pregnant?
Thank you, Aisha. If you look at the figures, what it means is that, yes, our Ashanti region over the period, that is between 2016 and 2020, has the highest number of teenage pregnancies recorded in the country. If you look at the statistics closely, the region recorded 89,856 compared to the second highest region, that is the Eastern region, with 56,730. That notwithstanding, the Regional Health Directorate says it is concerned with the figures because it assumes that if you look at the figures, though the region has done very well compared to the global figure of 11% and the national figure, which is around 13%, the region being able to record about 10%, 10.9% of the figures is an indication that the Ashanti region has done very well, but there are still more work to be done to safeguard the situation, to bring down the numbers. So it is in this regard that the Regional Health Directorate has started with these consultative meetings, meeting all the stakeholders to map up strategies to deal with the number of teenage pregnancies. Let me also mention that the Health Directorate is also announcing some gains made, especially in the prevention of teenage pregnancies within the period, specifically in 2020. It says it managed to, bring the situation under control and prevented over 2,300 pregnancies compared to what it managed in 2019. That is 36 of those pregnancies. So whilst a pattern is served at the back, is also urgent support from stakeholders, especially the traditional authorities and then the general public, to be able to bring down the figures.
Ohim is with our Health Desk, and we are live from our studios in Kokomlemle, and The Pulse is also live on all our social media handles. Tweet at us with the hashtag The Pulse. We take a break. We'll bring you the very latest from the world of sports. Stay tuned.